July, the peak of the summer, is also high time for outdoor accidents, especially burn wounds from grilling, fireworks, and car accidents. Ruth Ann Corsetto is a registered nurse from Family Care Visiting Nurse and Home Care Agency, and she is joined by Dr. Brian Coyle, a vascular specialist from Connecticut Vascular Center. Welcome to both of you.
Thank you.
First of all, let's talk about what Family Care Visiting Nurse and Home Care Agency provides.
We provide wound care for wound care patients from burns to vascular ulcers to motorcycle injuries and car accidents. So we really do it all.
And what type of injuries do you see this time of the year specifically? Wounds, I guess we really refer to them as wounds.
Yeah, I mean, we can find burn wounds, vascular wounds, really anything. It's even around the year. I mean, sometimes in the summer months they peak up because of the grilling outside and the fireplaces and the outdoor grilling, and so we try to avoid and teach our patients not to be careless with gasoline and all that stuff.
And we'll talk more about how to prevent, but what's the relationship between you and Dr. Coyle, your agency and Dr. Coyle?
Dr. Coyle and I have worked closely for years. His company excuse me, will refer over to us, and we will take care of his vascular patients.
Very good. What kind of wounds do you see from your perspective as a vascular surgeon, Dr. Coyle?
From our perspective, what we see is wounds that aren't healing, chronic wounds that could be helped with surgery on veins and arteries, things that are preventing these wounds from healing.
And how can we prevent or avoid some of these types of wounds?
Well, these chronic type wounds, a lot of times people won't know that they have significant disease in the arteries and the veins. I get referrals from within wound care centers and from the outside at Connecticut Vascular, and we can often help these patients with chronic wounds by correcting a problem that could be helped surgically.
And it's just through a surgical treatment that this can be corrected?
Whether there are blockages in the arteries or other problems in the veins that we can deal with surgically.
So we're talking about the chronic wounds.
Yes.
But of course, some of these wounds are not chronic. Some of them happen this time of the year, specifically due to a lot of things. What can we do to prevent some of those?
I think it's just being very careful and following. If you have a chronic condition that they want to monitor you for to make sure that it doesn't come back, you need to follow your doctor's orders. You need to wear your pressure stockings if that's what they say. I know the weather's hot and everybody doesn't like that, but that's what you have to do. And, you know, like I had said before, grilling, they have to be very careful to prevent burns, and be careful with gasoline and even like gas grills outside.
As well as we were talking for people who have wounds from such things as lawnmower accidents, that type of thing as well. So when they're out there, what do they need to be doing?
They need to be careful. They need to follow the directions and just not put their hands and their feet where they're not supposed to be, because accidents happen and we see it all the time.
And you also have wound care nurses actually who come to the home, is that right?
Correct.
And how does that all work out?
Either the hospital or like Dr. Coyle's office will call us up to let us know that there's a wound care patient, and they'll give us the orders, and we will go right out to the home and see the patients and take care of their wounds. And we're in constant contact, so we're always speaking, we're always, you know, talking about the progress or the decline of a wound.
What are some of the new methods out there, Dr. Coyle, that can help these patients deal with their wounds? Is there anything new out there?
Sure, there are a variety of different dressings, collagen-type-based dressings that help deliver factors to help to heal these wounds. And also we have multiple different types of dressings and new things on the horizon that are helping to heal these wounds.
And so many of the things that perhaps didn't get healed before are now going to be much more so?
Sure, definitely. With these collagen-based dressings, as well as skin substitutes, and even skin grafts from the patient itself will help these wounds to heal oftentimes.
Very good. For more information about Family Care Visiting Nurse and Home Care Agency, all you have to do is call this 800 line, 800-946-6331, or visit them online at familycarevn.com. Thank you so much for both of you for being here with us. This is great information.
Thanks for having us.
Great.
You're welcome.
I'm sorry I lost my voice.
Oh, you're fine. Don't go away. There's more Connecticut Style right after this.